Mariah. I think this is the first time Aiden and I have come together, and I felt like in the midst, we should come together on a very serious level and maybe just have what I call a doctor's den. Create an environment for doctors, nurses, and other healthcare workers to come together and kind of vent, so to speak.
Yeah, I think that people will like that.
You think people will like that?
People will like that. At least I know the healthcare professionals. They like to talk and they like to get their opinion out and have people hear about their opinion. So I think it's a really great idea.
So I wanted to just do a doctor's den. We're in the midst of an outbreak. And I wanted, I know, right? No, you say it like it's nothing though.
No, it's just an outbreak.
He said, ooh.
Ooh, I didn't say ooh.
I'd be like, ooh. But the whole thing is I wanted to create an environment where healthcare professionals could talk about what they're dealing with day to day, and where people like me, the wives, the families, can also share their stories and their experiences with what's going on. So I guess the first thing I want to ask you, Aiden, is is it any different from H1N1? Like, people have had the flu. Did we have the before and didn't know it? Why is this so much of a scare?
Well, the flu virus has been around for decades. So you're able to study it. You had some vaccine, you have some treatment for it.
Right.
So even though when they give you the numbers, oh, the flu killed this many people, the only has killed this many, but the reality is it's a new virus. Well, not a new virus, it's a new virus that has affected the human society. And it's having a drastic measure, and it's mutating so fast that you can't control.
So it's mutated.
In my personal opinion, I think it has been mutating, and it's being hard to control, or at least to get a good study on it, and it's spread as far as spreading so fast that you can't contain it right now.
So what do you feel like as far as just like our friends, our family, our neighbors, in the midst of this entire quarantine? Like, what should we do? Are we not doing enough? Do we need to do more? Do we need to stay at home? Should we go out in small groups? Can we party? What can we do?
I have people that come out and say, oh, it's just the flu, don't worry about it. I don't think that's the smart way of looking at it. As when you can see the rest of the world already has
Italy and China.
Yeah, it's affected, and it has a big. Well, now look at Italy. It's the number 2 healthcare in the world by WHO, and they have to shut down their whole country. We are the most developed nation, and we can't even provide healthcare workers the equipment.
In other words, we're about to embark on something bigger than what we're prepared for.
Exactly, and I don't think we should take it lightly. Even though the presents the same way as the flu virus, the symptoms, the cough, the sneezing, the runny nose, the fever, the shortness of breath, the body aches. Yes, then you could say it's the flu, but if it gets to the point where it hits you really bad, flu, just like the flu virus, it does kill people. We just don't have any treatment for it. So it's gonna have that much of an effect.
And it's moving fast.
It's moving too fast because again, people are like, oh, it's just a flu, don't worry about it. No. You got to worry about it.
Okay, so far from home, what I've experienced, it's been a lot just being at home. Just a couple of days. It's honey, she's going stir crazy, and I think you are definitely
I was supposed to be on vacation this week.
Experiencing cabin fever. I think from a home perspective, it has taken a toll because the kids are doing education via distance learning. They're doing it all Google Classroom, and it's hard because they're adjusting. They're used to going to class. And I think the other thing is and it's like the elephant in the room.
I agree to that.
Aiden is the pariah of the family. If you have a family member that's in the medical field, they're the pariah. They walk in, I'm serious. And you're like, did they take off their scrubs? How many germs do they have on? Did they take off their shoes? How many people did they see? Have they been exposed? What are we supposed to do? Are we gonna be quarantined? Why won't they just quarantine the medical people?
Sorry.
See what I'm talking about?
I'm using my hand sanitizer, okay?
Babe, that's for real, for real. Right. See, this is what I'm talking about. This man sneezed all day, every day. All day, every day. Oh. This is not for play. This is not for play, not anything. This is what I'm experiencing. Aiden walked in this morning and sneezed 6 times in a row because of his allergies and sinuses. What am I supposed to do? As a wife of an ER physician, he's first line, and he's experiencing his everyday life, but now outbreak life.
Yeah, it is kind of sad because...
Can I take this down?
Sure. You want me to put mine on? I put mine.
I think you should put yours on.
Okay.
Yeah. He coughing every 5 minutes. Everybody will put theirs on.
Right. Well, my
If you
thing
put
is,
yours on, we'll feel better.
Okay.
Thank you.
Well, my thing is, I think from a healthcare professional wise, it's a little disappointing and discouraging. Is that when I talk to the coworkers and colleagues, them going home, and even I didn't think of it till you told me like how the kids feel. Why the kids away in their room? They're not coming near me. Why is our little nephews and are not coming by? They don't want to come by the house, and I didn't think about it.
Don't nobody want to be around Aiden right now. No, nobody in the family.
Somehow I have the cooties that I don't have, but somehow
nobody wants to be around Aiden right now. Like I told you, he's the pariah of the family, and it's nothing you've done. But and rightfully so, you should respect that. We're listening to healthcare professionals, not politicians, about what we should do in terms of being proactive for our health. And you should understand that maybe they should have quarantine. Or maybe they should quarantine the doctors and the nurses and the healthcare workers.
Then we ain't coming home.
But you know what? We want you at home, but we will email you and we will text you guys. But you don't want to do anything that's going to put your family more at risk.
Well, I think more importantly, if whatever the media coverage is going on, it's more the healthcare workers don't have the equipment. We don't even have, that's the N95 mask that you wear. We don't even have that.
I agree.
We can't even wear that. We can't even wear our mask because the lack of supply. And yet we're the most developed nation with the most economical, and we don't have resources for our healthcare.
I think that is a huge area of concern. That the front line, whether it's ER doctors, ER nurses, internists, whoever, like they just don't have the equipment they need. And how can we expect someone to take care of us if they don't have all of the supplements and everything they need, the resources they need to be covered and make sure they don't affect their family?
Well, that's what I'm saying. People gotta take it seriously, okay? Just like the CDC recommends, wash your hands, sanitize the areas, keep yourself distance about 6 to 10 feet from people.
6 to 10 feet from people.
Wash your hands.
You have on a mask. So I'm going to translate since he has on a mask.
You're my translator,
I'm your translator. So wash your hands.
Wash your hands.
You said 6 to 10 feet from people. Distance from people. 6 to 10 feet distance from people.
And if you have the symptoms of the body aches, the low-grade fever, the sneezing, the runny nose, quarantine yourself. Well, right now the study is saying 14 days.
14 days quarantine.
So
in the house.
So just think of it as a 2-week vacation in your house. That's what I gotta say.
Non-paid vacation. Because at this point, ain't nobody getting paid. Cash.
Well, Netflix and wine and cheese or whatever, you'll be all right.
You'll be all right?
You'll be all right.
So at this point, do you think that we are overreacting about the...
No, I think,
about the virus?
I don't think we're reacting enough. And that's the problem. The thing is, when you see like Italy and Spain all quarantined, those are smaller nation in the sense that they're living, they're more confined, and that's why it gets affected. USA is more, obviously it's a bigger nation, it's big spread out.
Sporadic.
And we have more space among each other. So we're not seeing the effects like how Italy and Spain see. That's so we're humans are visual. We're not visualizing that effect on us, and that's why we're not taking it that seriously. Where the other nations, it's in front of their face, it's happening, so they're taking it seriously.
So moving forward, as an ER doc, what do you hope to see people do? Like, do you want us to just stay at home and keep your ass home and chill with the fam, or do you want what is it that we can do to make it easy?
I think that definitely. I think people should stay home. Even if you're not sick, even if you're not feeling anything, because you don't know. The studies are out there that you can be asymptomatic and still spread to other people, and you could be fine, right? But the grandma, grandpa, the elder uncle, you go and spread it to them.
But y'all keep saying that it's not just older people.
It's not the older people. I'm just saying, but the extreme of age are the ones that are more vulnerable because of the immune system or even.
I agree with that. And I do think that the older people are being affected. But we're in Atlanta, Georgia. And I want to ask you this. And this is a very controversial question. But it's real and it's what I'm thinking. Like Atlanta is different from any city. But we have a high population of HIV and AIDS.
Yeah.
HIV and AIDS.
Yes.
So I'm asking you, like people keep saying people 60 and over will be affected with underlying issues. I want to ask you, how are the people going to be affected, whether they're young or old, with HIV, AIDS, metabolic disease, diabetes, heart disease?
That's the point. That's your immune deficiency criteria of the people. So people with HIV, AIDS, or even some type of cancer, or even if the cancer is remission, your immune system is already hampered. Once your immune system, if you're immune deficient, you're much more vulnerable. Their effect is not as strong, and their immune system is not as rapidly responsive as quote unquote young, healthy, or even elderly, healthy people. I mean, I don't want to say Tom Hanks has it, Idris Elba has it, NBA players, they're healthy people, they have it. Right?
And they're asymptomatic. Some of them are
asymptomatic, but they can spread it to people around. Let's just say they're walking in the store, some elder folks who's just getting his, or even in your aspect, some person from Atlanta or whoever a person who's got the HIV or AIDS or some kind of comorbidity, and they sneeze and cough on them, whatever, or touches them on their face or whatever, and they can get really sick really fast. So that's the whole point of just controlling yourself.
Not only do they really, like me getting it and someone or some healthy person getting it, and even a healthy person.
Yeah, healthy person can get this. Yes.
And even a healthy person can absolutely go decline immediately. But I think it's really hard with someone that has an underlying issue like HIV. I feel like that's something we're not talking about. I don't know if it's taboo in our community, but this is Atlanta, Georgia. And it's something we gotta talk about. For a lot of other communities, we're talking about the age thing. But if the underlying issue is big, not just the AIDS and HIV community, the Black community, or the minority community, how people are going to be affected that already has heart disease, which is the #1 killer in the world. You fall out from a stroke and a heart attack. So a stroke, heart attack, heart disease, diabetes as the underlying issue with is not a good cocktail.
It's not a joke. I think people still, I guess in our nation right now, people are still not really taking it that seriously. And it's my opinion of that at least more like I would like them to see taken more seriously. I'm not saying the news media or people telling you to do the, just from observation, people are not taking it seriously.
So let me ask you something, and you take your mask off.
I don't know, because I do sneeze and stuff. So
I know if you're gonna sneeze, put your mask on. Like
I can't control my sneezing. It comes. The other thing is the proper way of sneezing. If you don't have any tissue or a handkerchief or something to cover your mouth, tendencies we're gonna touch our face somewhere or the other. We're gonna shake somebody else's hand. So proper way. If you don't have a handkerchief or towel, put it into your elbow or your forearm.
I think the proper way of sneezing.
Or you have a proper. I don't know if there's an etiquette.
There is an etiquette.
Tell me the etiquette of sneezing.
Don't sneeze during this outbreak. You can't sneeze. You can't have allergies. You asked me, I'm telling you. Take your ass outside and sneeze. Don't sneeze. Don't sneeze at work. Don't sneeze at home. Don't sneeze in the house. Don't sneeze in the car.
Oh my
Don't sneeze. If you got allergies, you need to take care of that. In a place with yourself. You need to get to know yourself. But don't do it in a public place. It's as simple as that. I don't think that's much
So the etiquette of sneezing is don't sneeze at all.
Damn right.
Oh, okay.
Yeah.
Thank you. I'm glad to know. Thank you. Appreciate that.
I'm glad to inform you.
What if it comes out the other way then?
Oh, God.
Then what happens? You hold it one direction and then,
Is that happening?
So
now you sneezing that shit?
Yeah, now what if you sneezing that? Hey.
Oh my God, you are just doing the most today, aren't you? You sneezing that shit?
I'm just trying to get the etiquette of this thing.
The etiquette is not a word, first and foremost.
Okay.
You want to know the proper
The
etiquette?
proper etiquette. I'm sorry. Let me say the proper etiquette.
Exactly. Get your shit together.
All right.
You've been over here longer than me.
All right.
I think the biggest concern for me as a wife is that you, as a doctor or just anybody on the front line, is not prepared in terms of equipment. Like, I know there's been some issues at not only your hospital, all the hospitals around the nation. Like, the front line is not prepared. They don't even want you to wear masks, or they're saying the masks are limited. What does that mean for you and your health and for your family, for my health and the kids' health?
Yeah, that's a very, scary situation, because we are limited as far as the equipment or the attire.
So you can't wear a mask. Can you
But-
wear a mask to work?
No, the problem is I can't even wear a mask because the information getting is we're not allowed to wear it. And I'm like, well, if I bring my own, why can't I wear my own? But
You can't even wear that.
yeah, whatever their recommendation is, if you work for an institute, you have to follow the institute rules.
But I see doctors posting in masks. So is it a facility driven thing? Does it depend on, like, is it one thing at your hospital, another thing at Dr. Eugene's hospital, another thing at Dr. Feaster's hospital? Like, is it different every facility? Honestly.
I think, nationwide, as far as administration, each place has different administration, so how the rules are different. But as far as the nationwide, the equipment, the PPP, the attire, the personal protective equipment,
Oh, that's what PPE is.
the whole outbreak suit.
So the PPE, I'm going to use the appropriate name. The PPE.
The
PPE.
The N95 mask.
The PPE.
Yes, the PPE. That's limited resources, so each nationwide they're telling everyone only.
So they get
situation.
more and more limited.
Yes.
So you don't have enough.
No.
So let me ask you this. As a doctor, if we come in, as the ER doctor, you front line, if we come in and we have symptoms, how can you take care of us if you ain't got on a damn mask or the right kind of mask?
Well, that's the caveat to the front line of the job, I guess. I don't know.
Damn, I just feel like I really want to see the front line covered. It's important to me as your wife, but it's important to me as a person in this community. Like, we don't want to spread it.
Right.
We want to educate. And I do believe the leaders, like the doctors, the politicians, the people on the front line that are dealing with it, should set the example of what we should do, what the rest of the world should do. So I think it's important to see you guys in masks and gloves, the right kind of mask, because you're teaching us how we should.
There's a caveat to that, because some people will look at it as that's scaring the patients.
Oh, that's what
Okay.
it is. So we don't want to scare the patients.
You don't want to scare the patients.
Because perception is reality.
Exactly. So that's that,
What do you think? Do you think it's scaring the patients?
I think when you're in a situation like how our nation is going through right now, I think people are aware of what's going on. In my opinion, they kind of understand what's going on. So I think they're okay with it. Now, if we weren't in this pandemic situation and I walk into your room, examine you in this attire and all that, yeah, I'd be scared.
In a space suit.
Yeah, I'd be scared. Tree shit. What the hell?
Okay, you want to say two shit so bad.
But the whole point is, yeah, I think now that we are in a situation and everybody see what's going on, I think people are acceptable with that.
So you think it's okay for you to wear all of your gear because people understand it in the midst of an outbreak?
I don't think let's be logical.
Yeah.
You're not gonna wear the whole outfit, gear, whatever.
I think you should have the whole. I am okay. I believe that you should have on the whole.
No.
Like the bee gear, like what they wear when they're
the beehive,
doing the bee, the whole beehive gear, like with like an astronaut.
Yeah.
I believe that that's the gear, attire that you should have on, like if that's what it requires. Like I really do. I don't think it's a big. It's not about perception. It's really about safety. I think that you have to remember that not only are the medical professionals teaching, but you guys are saving lives. How can you save lives if you can't even protect your own?
I agree. I think, but the whole extreme measure of wearing all that, I think that's going a little too extreme. Just like people going to the store and the toilet tissue is gone, the water is bare, I think it just went a little too extreme. Okay, so you have to also limit your thing. extremism. Okay, yes, the gear is accessible, but when it's really sick, right? When you know they're we have to they're infected and stuff. In
Day
to day, you're not gonna. That's not required. Now, do I suggest that we actually wear a mask or either the N95 or surgical mask? I think yes, that should be mine, because you know what? As you see myself, allergies and whatever, I'm sneezing. That scares. Yeah. So that at least.
And people don't want you around when you sneeze.
So I think that's fine. I think when you are limiting that is a problem.
So the other thing is we talk about you as a medical professional, as an ER doc on the front line, what you should wear. What should regular people wear? Like, should we wear a mask every day? Do we need to wear long sleeves? Can we go out? Like, what should we wear daily?
As long as you're maintaining a proper hygiene. Okay?
What is the proper hygiene? Washing our hands?
Wash your hands, cover your mouth, that etiquette of the sneezing and so don't sneeze however you want to say.
Well, you sneeze every day.
All right.
Several
keeping
times.
yourself, keeping the distance, at least in this time period.
What's the distance?
6 to 10 feet.
Okay.
Okay. And even also gathering, they're recommending now less than 50 or less gathering.
50 or less people.
People gathering. So I think those are the preventive measures that you want to do. Okay. Not going out, getting you a spacesuit and doing that. I think that's overkill. It's the same thing as overkill.
I don't think it's overkill at all.
Again, just like anything, you have to do the safety measures.
Yeah, you do.
And that's what it is.
Should we wear gloves when we go out? Should we wear gloves when we?
I think if you're handling a lot of things with contact with a lot of people, let's just, for example, if you're a cashier,
Absolutely.
then you should probably wear gloves because you're interacting with people's hands and things like that.
Well, thank you, Aiden, for just giving us your insight.
No problem. Thank you.
In the doctor's den. Aiden came to the doctor's den in his basement. Ain't it
Thank
cute?
you. Yes, thank you so much.
Why you didn't even have let's toast to
people's safety.
Let's toast to being safe and pushing through.
Pushing through with proper etiquette.
With proper etiquette. Okay. Thank you for following me. Don't forget to subscribe to my Mariah Huck YouTube channel. Check out mariahhuck.com and follow me on Instagram and Facebook at Mariah Huck.